Welcome to the Secrets to Mindful Health, where we explore the hidden truths of wellness in all its forms. From physical and mental health to spirituality, join me, your host, Beth Warren, at Nourished by Beth on Instagram and TikTok, registered dietitian for over a decade, and single mom of 6, as I share my personal journey overcoming challenges towards self-love and wellness. Together with my guests, we will inspire and motivate you to prioritize your well-being and create a life of balance and fulfillment. Let's embark on a transformative journey towards a healthier, happier you. I'm glad you're here. In this episode, Beyond the Bedroom, Dr. Justin Dubin reveals the hidden truths of male fertility and sexual wellness. In this eye-opening episode of Secrets to Mindful Health, we sit down with Dr. Justin Dubin, a leading expert in male infertility and sexual health. Together, we explore often overlooked aspects of men's wellness, uncovering the secrets to enhancing fertility and improving sexual health. Dr. Dubin shares practical insights, debunks myths, and offers actionable tips for men looking to optimize their reproductive health. Whether you're navigating fertility challenges or simply seeking to enhance your overall well-being, this conversation is packed with vital info and empowering advice. Dr. Justin Dubin is a urologist at Memorial Healthcare System in South Florida, specializing in men's health, including sexual medicine and male infertility. A Wayne, New Jersey native, he graduated from Johns Hopkins University and earned his medical degree from Rutgers Robert Wood Johnson. He completed his urology training at the University of Miami and a fellowship at Northwestern University. Dr. Dubin is dedicated to improving men's health and education, having published multiple papers and been featured in the New York Times, Wall Street Journal, and Men's Health. He co-hosts the podcast Men Up, A Doctor's Guide to Men's Health, which aims to destigmatize men's health topics. In his free time, he enjoys exercising, playing paddle, reading, and cheering for the New York Giants. His Instagram is at Justin Dubin MD. Welcome, Doctor.
Beth, thanks for having me. I'm so excited to be here, one New Jersey native to another.
I know, it's exciting. I feel people will feel refreshed by your presence in many ways, but also I'm always speaking about women and women's health and women's wellness, and I'm not flipping the coin to the other side.
Yeah, it's honestly, it takes two to tango, right? So anytime that we're having issues, anytime that there's women's health issues, and if you have a partner, the men's health aspect comes in, especially when it comes to having a child and engaging in sexual activity, right? We want to make sure that everyone's healthy, everyone's happy for us to have the outcomes either in the bedroom or for family planning, for sure.
Yeah. So what led you to then focus on the male fertility aspect? And I loved how you even said with your podcast, like you're looking to destigmatize. And that's what my platform also is all about, is to let go of the shame and judgment and start bringing up to the forefront, like speaking about and communicating about these issues. So first of all, people feel less alone, but also then they can recognize how much not only support there is out there, but help that they can get because of it.
Yeah. And I think for me, I was always interested. Obviously, I was interested in medicine, in the space of medicine. But what really intrigued me about sexual health and fertility was this idea that we overlook of sexual health and fertility as actual health, right? You know, when we deal with a lot of medicine and we talk about medicine, a lot of it is thinking about it from a framework of don't die, let's prevent you from dying, let's treat something that is already there. And we're not focusing on, we're more focused on quantity of life, not quality of life. Mm-hmm. And when I look at what I wanted to do is, listen, if you had cancer at 25 years old and for some reason you're struggling to have a child, you know, your quality of life may be suffering. Or if you had surgery for your prostate cancer and you're cancer free now, but your erections aren't where they want them to be, you know, your quality of life is suffering. You know, cancer sucks, life after doesn't. But at the end of the day, I want to show people that your sexual health is health and your fertility is a window into your overall health at that time. And I think for a lot of guys, they're very scared to talk about their health, especially things like fertility and erections, which they associate with their masculinity. But B, they don't like to go to the doctor. And if I can point to you and say, hey, listen, if you like having sex and getting a good erection. You better not have diabetes. You better not be overweight, and you better go to the gym and eat healthy. I think that we can motivate men to take better care of themselves.
Yeah, I mean, it's like I said, it's refreshing to hear this also coming from a doctor perspective. I feel people like you, maybe I don't know if it's a younger generation thing or what, but it's starting to feel more wellness oriented, which feels very special because it's medically inclined, meaning you can actually help in many ways from a medical perspective, but you're appreciating and valuing the aspect of wellness and the areas that are affected. And with a topic like this, I know you have to have a degree of sensitivity too. Like it's a very personal topic, like many things are, but I see people coming to me for fertility and nutrition in my practice. I live in a Jewish community where there are a lot of children, there are a lot of births, so the stigma is even more strong with people who are having issues. But many people are. I always wish I could share, which I never would because of HIPAA, but how many people are experiencing similar issues. And I still find that with fertility, I mean, it's becoming more spoken about because there's organizations there to support, especially the expenses associated with, which we could talk about too, the expenses associated with therapies, or interventions for this. But I see mostly women coming
Yeah,
for
and
nutrition intervention for fertility, and men can come too.
absolutely. And this is something that we do poorly as a society, is that we put this unfair stigma and burden of fertility on the female partner. We know the data shows that about 1 in 7 to 1 in 6, about 15% of couples struggle with infertility, which is by definition, if you're a female under the age of 35, trying for longer than a year and not achieving a pregnancy. If you're above 35 to 40, it's 6 months. But about 15% of couples struggle with couples fertility. And when you break down the numbers of what's causing that, believe it or not, 50% of the time, there is a male component involved. And about 30% of the time, there is strictly a male factor is the cause of couples infertility. And yet you don't have men discussing these things with doctors. They don't want to get worked up. They don't want to get checked up. And one of the things that I tell my patients, especially when they start to see their female partners going through it, is listen, your best ability is availability. All you
Yeah.
have to do, it's very simple for a male workup, right? It is one, you come in, you get a history with me. I learn about you. I learn about your lifestyle. I learn about your diet. And I learn about your partner's history as well. 2, I do a physical exam. I check your genitals, make sure everything's there. 3, blood work. And 4, a semen analysis, which I'll tell you, a semen analysis you can do at home from the comfort of your house. And if you look and see what your female partners are getting done in their workups, this little process here
Is
is
not
a
a big deal.
lot less invasive and a lot more benign. So I think it's one of those things that if you are just at least doing the work by showing up and seeing a doctor, I think it really goes a long way to your partner. And God forbid there is something going on, we don't waste any more time and we can address it.
Right. It's like trying to just look at everything and tackle the issues head on, like you said, so you don't waste any time versus trying the more, I guess, less, I don't even want to call it invasive, but just, more less sensitive. Like meaning men, like you said, they don't like to go to the doctors. They feel more feelings about it that they have to overcome. But if you just like put it out there, just let's just. I do the same thing with my practice. I'm like, I ask a line of questionings that sometimes surprise people because food is not just about food, and I never just tell people what to eat. I have to understand why you're not able to keep this, all the areas and all the other wellness windows that people can focus on in order to help their food, or when their food can't be helped, you still can do workouts, you still can do whatever it is. So it's just funny how with this situation, I wonder how we can, first of all, is there a way to more identify that there is an issue, or is it only when they're looking to this could be a very silly question, but
No, that's not a
if
silly
I have it,
question.
other people have it. Like, is there a way to flag this before the actual, I want to have a baby
Yeah,
moment?
of course. So honestly, this is a great idea that I think that people are really coming to have a concept of more, right? I think that people when have this idea and it's put in schools and it's the way we're educated is that like you have sex once, you're going to have a baby.
Hmm.
And you're going to get pregnant if you don't use protection. And that is not the case, right? I think about 10 to 15% max monthly with unprotected sex is the chances of you, with all normal things being put aside, of you conceiving through penetrative intercourse on a standard month when you're
Hmm.
timing everything. But I think this concept of understanding, identifying risk factors that put you maybe at a disadvantage for your future fertility is a newer concept that
Hmm.
I am a huge proponent of, right? So I think the most important thing you have to understand here, like I said in the beginning, and we'll highlight this now, is your fertility is a window into your overall health. So there are so many lifestyle things that you can do to optimize your health and to optimize your fertility. And some of those things, even though they may be actually healthy for you in general, may not be healthy or good for your sperm, believe it or not.
Hmm.
So if you are someone who is thinking about having a kid, maybe not now, maybe not in 6 months, but maybe in a year, or maybe 6 months, but you can already start preparing yourself, because the important thing to understand here is that your sperm cycle is about 3 months. It takes about 3 months to develop, which means that anything you do positively, it takes about 3 months at least to impact the quality of your sperm.
Hmm.
Anything you do negatively, it also takes about 3 months to recover. Sometimes it can take longer depending on whatever that thing is. Now, what are things that can impact the quality of your sperm that you can actively do? Well, we know being overweight, being sedentary, eating poorly, these are things that are associated with lower sperm counts. They're associated with lower testosterone levels. So, eating healthy, obviously, as you know, and I wanted to highlight that today, is incredibly important for optimizing your health and optimizing your sperm quality so that you're not overweight. Weightlifting improves your testosterone more than cardio. Cardio is
Hmm.
good, but cardio has, I think, releases more cortisol levels, which can lower your testosterone. I'm a big fan of cardio. I do cardio all the time. But if you have to choose, because I know that we are all busy people, I always recommend weightlifting. You're burning a lot of calories. You're increasing your testosterone and your muscle mass. Getting good sleep is very important for your testosterone levels. Is at least 7 to 8 hours of sleep a day. Reducing stress, which is the easiest thing to say, hardest thing to do. I really don't have any advice for you for that one. But we know smoking cigarettes. There's new data suggesting vaping as well can potentially compromise your sperm quality, as well as smoking marijuana. Now,
Hmm.
high consumption of marijuana, I can't give you a definition of what heavy consumption is, but if it is something you're serious about and you want to optimize your fertility, I always recommend reducing your marijuana intake. And a couple other things that I really want to highlight. These are the biggest one is taking testosterone replacement therapy. A lot more guys
Hmm.
are taking testosterone more and more in today's day and age. And in general, I don't have a problem with that. I give testosterone all the time to my patients. But if you take the real deal TRT, what it does is it signals to your brain, tells your brain you're making enough testosterone. It shuts the signal off to your testicles and it stops
Hmm.
making sperm and it stops making testosterone. And therefore, about 60% of guys after 4 months of being on testosterone have no sperm in their ejaculate.
Whoa.
And it can take up to a year. 90% of guys have return of sperm to their ejaculate in a year, about almost all of them at 2 years. But once again, this idea that if you're doing something that you need to plan in that ahead of time for future fertility, this is something that can take time. And you have to address these things early on, maybe before you're starting the family plan. The final thing is wet heat exposure. So I have a lot of guys, very healthy guys, they go to the gym, and saunas, steam rooms have a lot of health benefits. However, they are not good if you're trying to have children. Your testicles are outside your body for a reason. They like to be a couple degrees cooler than the rest of your body. So going in a hot tub, sauna, steam room, jacuzzi, you're cooking those boys and you're temporarily killing your sperm. So that's another thing that I've seen in guys who come in with very, very low sperm counts who are very healthy. They exercise, they eat well, they're peak physical form, but they go in the hot tub every day, or they go in a sauna every day after at the gym, which in general, if you weren't trying to have a kid, is fine. But once again, it takes time for your body to recover, and you're going to have to stop that in a plan accordingly.
Wow. I loved all that for many reasons. First of all, I'm happy I'm not a man because I'm obsessed with saunas. But for women, they give other things, about sweat and other things about their parts too. But again, this is very wellness oriented. Nothing you said is foreign to any concept in any area of health. That's the beauty of wellness and going the natural route is one thing you do. I call it like bowling. You hit one pin, it hits a lot. So while we're focused on male fertility today, whatever you just said helps everything related to health, nutrition, your weight, etc. There's never one thing you do in the realm of wellness that's evidence-based that is a waste of time or doesn't help something else. And it's the gift that keeps on giving because it continues to help all the other things. And that was a lot of insight because you went to the medical route of, let's say, labs and things like that, but also just lifestyle things. And who knew about the saunas? So that was a big one because, let's just be honest, like with men, they'll jump on a bandwagon. Not all, some really do research or whatnot. But if they're also not talking about it with their doctors and they're also not knowing, they really just have no idea. And they wouldn't.
How would you know? How would you know? How would you know that? I
didn't even know that. It makes sense when you say it. But let's segue a little bit into because I saw even your podcast, you do actually talk about sex. And I wanted to shout that out here because I never talk about sex on here. So let's talk about sex.
You should always be talking about sex.
I know, right? So in the realm of that, and even including in male fertility, is that at all related or is it really not anything to do with
Oh, it's all related. It's all connected. Everything that you do with health and wellness is connected because if you want to get a good erection, you need to be pretty damn healthy, right? So how I describe to my patients is if you want to get a good erection, you need 5 things. 1, you need good blood flow to your penis. Now, what can compromise good blood flow? Smoking cigarettes, vaping, having heart disease, right? We call erectile dysfunction the canary in the coal mine. It is, if you have erectile dysfunction, you're significantly higher risk for having a heart attack, 10, 15 years down the line. And a lot of vascular health, right, is, coronary artery disease. Diet impacts these things. Exercise impacts these things, right? Number 2, you need good nerves. What can compromise that? Diabetes, right? So poor diet impacts your risk profile for diabetes. Having poorly controlled diabetes, we think of our hands and our feet and our eyes with diabetes, but guess what nerve is smaller than all of these things? The one in your penis. And I don't care how big your penis is, it's much smaller than these nerves, right? So that is often the first thing to go before the hands, the eyes, and the feet. And I see guys all the time who are overweight. They come in for erectile dysfunction and they go, "Doc, I don't know what's going on." And I go, "Well, have you been diagnosed with diabetes? Do you have any health problems?" And they go, "Doc, I'm completely healthy." And I say, "When was the last time you went to the doctor?" They go, 35 years ago. I said, "Well, you can't be diagnosed with anything if you've never been." So I've diagnosed so many guys who come in for their erections with diabetes, they have high hemoglobin A1Cs, low testosterone, obesity, high blood pressure, all of these problems because I'm often the first person that they want to talk to because their penis is more important than everything else, which I understand as a man. But the problem is we're still relating it all to your health. So 1, blood flow, 2, nerves, Also nerve surgery, right? Prostate surgery, radiation to your pelvis, other issues like that. 3, testosterone. We already talked about things that impact your testosterone: obesity, sleep, health, weightlifting, lifestyle, diet. So that's all those things. 4 is you need to be aroused, which sounds funny, but it is one of those things where I ask how everything is going on at home. And if you don't like your partner, or you're in an argument with your partner, I don't think you're going to want to have sex with them. So I
Yeah.
very often recommend a sex therapist to people who are going through things. And listen, we all have our life problems and our stories to tell, and our relationships change, but that doesn't mean that they have to end, or it can't be fixed. But sometimes you need to seek an external source to get that help that you need. And then 5 is you need to be in a good state of mind. Stress, anxiety, depression. This is often one that we often see in younger people, right? Or unfortunately, medications that can treat stress, anxiety, depression can also cause erectile dysfunction and decreased libido. And of not in those things is just, I wanted to give you how common erectile dysfunction is. Erectile dysfunction is the most common sexual health problem that men face. About 30% in their 30s, 40% in their 40s, 50% in their 50s, 60% in their 60s. You get the idea.
Yeah.
So it is incredibly common, and the chances are you or your partner will have erectile dysfunction at some point in their lives. But the good news is there's a lot of ways to address it. There's a lot of ways to treat it. And what's good for your heart is good for your parts. What's good for your heart is good for your penis. So talking to people like a nutritionist, getting exercise when you're younger and being healthy will prevent you from having these problems later on. And, having a good, strong heart, you're going to have a good, strong erection, hopefully.
Right. I was going to say, is it preventable in the sense where, like, for example, bone health, and I'll flag, because we do our body composition analysis, very low muscle tone in, let's say, women from young. And I say, okay, you're happy now, you feel skinny mini, whatever. But as you get older, your bones are really going to suffer and you're going to really regret it. And now's the time to really build the muscle so you could start protecting your bones. It does sound a little similar in this sense, because a lot of what you're sharing is about long term, that whatever you do now takes place years later, months later, whatever it is, and whatever you do not good, it takes months to fix. Like, it's very actually interesting that there's such a long, like a delayed onset, or some, I don't know, some time component with this that I find interesting.
Yeah, I mean, listen, sexual health, if you have something going on with your sexual health, this is the most important thing. Sexual health is health, right? If you have something going on with your sexual health, if you have a problem with your erections, it is either a direct cause of something bad going on, or it's a warning sign of other future health problems coming down the pipeline. So it's something that you should take seriously. And consider seeing a urologist or a healthcare provider to at least talk about, because maybe they can find other things that are going on. I mean, listen, sometimes you have a bad night, you have too much to drink, you have some stresses in your life. Like I said, no one's batting 100. And if you have friends out there who are saying they're batting 100, they're lying to your face. I promise you that, right?
It's like the couples who say they never fight.
Yes, correct. And I do want women to understand that it is not their fault a lot of times. And I think this is a very, very important concept that I had come across. I had been seeing it asked so many times by partners who would come in saying, the female partner would ask, is it my fault? Is it my fault? So we actually did a study. We surveyed, I think, about 14,000 women. And we asked whether they had experienced erectile dysfunction with a partner, and if they had been blamed for their partner's erectile dysfunction. And about 1 in 7 had been blamed by their partner at one point for the erectile dysfunction. And those women were much more likely to end the sexual encounter. They were more likely to end that relationship because of the ED. They had increased stress and anxiety with that situation around sex with that partner. And I think it's important to understand that for the women, after everything we talked about, obviously, if you're having a bad time with that partner, that has nothing to do with you. That's the situation. But you should not feel that you are the cause of someone's erectile dysfunction. And if they're blaming you, there's something else at play. I think men are very insecure about these things, obviously, because this is how they identify their masculinity. At the same time, though, you shouldn't make fun of someone who also has erectile dysfunction, because once again, that doesn't make it better either. So it's a two-way street, but I do want women to not feel like they are, the sole cause, or they are the major cause in any capacity of erectile dysfunction. As you've heard, there's so many causes and things. It's not that he's less attracted to you. It's not that, he's, just doing it with someone else. There's a lot of factors at play.
It's actually refreshing to hear this. I'm sure for a lot of women, because it's so mysterious still. And if people just, like what's how do you, it's, I don't know, it's very unique because it's such a intimate connection and situation that how can you not make it about you unless you knew this has nothing to do with you. Like, look at all these things and factors, and then like I said, seek support, go get help. You can adjust this. And wow. But even what you said about flagging felt very special to me, because I became more and more intuitive over the years, not only personally, but I'll never forget, when you start out as you as a doctor, me as a dietitian, and you're like coming like from your textbook mind, and you're like ready to go. And then you're realizing, wait a second, it's not just telling people what to eat. They're not doing it. Why are they not doing it? You start asking questions along the way. Like, you start to see commonalities, you start to see threads, and you're like, wait a second. So yes, I can tell you what to eat, but that's actually not the work we need to do. This is what we need to do. And everyone's work is different based on their life and what's going on. And that becomes more intuitive, meaning you're going more inward of yourself to identify areas that you need to work on in order to do this, right? So same thing with this stuff, like, what you need to do in order to be healthy, in that sense. Like, everyone's need to do is different. But when you become like that, you start to recognize that your body's speaking to you. Like, it's telling you, it's if you're starting to feel anxious, like, that's an alarm bell. And also, when you start to work on yourself, you see the alarm bells versus just living in anxiety, right? So you don't know, because that felt normal to you forever. But when you start to talk about these things and unravel them and get deeper, you could see the flags, and you're like, oh, that's how God made us, like flag, these things that are talking to us. One of the most eye-opening things, actually, for me, I guess, because that related to me, was that anything related to erectile dysfunction, fertility, that's a flag. It's you like meaning, it's like a special, like, you're grateful in a sense to have that alarm bell or red flag like come up and be like, if we just listen to our penis, we would be very healthy.
Yeah, I was going to do a pun there where you said that the alarm comes up where it actually can't
Yeah.
stay up, but
Right, I couldn't stay up or something. Like, I'm trying to think what's like that for women. I mean, women get, like, I notice that pelvic pain, you really do get
Mhm.
like a pelvic pain from like a fight or flight mode. But this is like a very clear, like, direct, you won't go up, or something's wrong. I don't know. I
Men,
just found it
I
very
like to
special.
joke around, but it's kind of true. Men, we are quite simple. Women
Yeah.
are much more complex sexually, and pretty much anatomically. I mean, we are pretty dumb animals. We're just, it works or it doesn't, and we got to figure out why, kind of thing.
Yeah, and you got to listen and go do something. Like, it's interesting. We're different in many ways. And like, even when you said earlier about what men can take in procedurally, and I just think of, like, all I was thinking, like, I didn't want to sound dumb, but was like waxing. And like, women could just shut up. We do electrolysis, we do waxing, and now men do a lot of that too. But apparently, I hear it's very different experience for men. So I don't know what it is. We're just made differently, which is why I appreciated you coming on, because your perspective as a man and a doctor and a specialist in this and all that was just, it's relatable to not only men, but I knew I would, but I got something out of this as just a woman, a woman with no partner right now, but a woman. And I could relate when I did have one. And also as a dietitian, for all the lifestyle aspects of it, which is the goal of my podcast, being just a wellness platform, because it's all connected. So I want to thank you so much for coming on. If we could leave anyone with some tips, I mean, you were very succinct. I loved your points, but what kind of message would you leave everyone with?
Well, first off, thank you for having me on. I really appreciate it, Beth. This was really wonderful. And I think that, you're right. health is wealth. And I think that this idea that it's all connected is inherently true. If you're serious about your health and you're serious about your quality of life, I think you need to act accordingly, right? I always think to myself, and how I motivate myself and I try to motivate my patients is, we see people and you say you want to live to 100. But what kind of life is living to 100 if you're not living your best sexual life, your best overall health, right? If you want to live a good life later, you need to live a good life now. And I think it starts with all the things that we've talked about today. Health, your diet, your exercise, decreasing stress, getting good sleep, all of these things are all related. And if we really want to do right by ourselves, our friends, our family members, to be around for the future, we need to really focus on those things.
That's amazing. I love that. Don't forget that we can all listen to Dr. Dubin more on his podcast, Man Up, A Doctor's Guide to Men's Health. And you can follow him on Instagram at Justin Dubin MD. Thanks for coming on.
Thank you. Happy.
Don't forget to hit subscribe or follow me on Instagram and TikTok at Nourished by Beth, or listen on Spotify at the Secrets to Mindful Health podcast.